What is at the heart of root cause resolution medicine? We asked Dr. Peter Bongiorno on the Functional Forum panel.
Yeah, well, the first thing I think of in naturopathic school, going to medical school and out in Seattle, I went to Bastyr, and I remember from day one they started talking to us. I remember they pulled us out of anatomy class, actually. It was our first anatomy lab, and they took us out and they brought us into the auditorium, and the president of the school, who started the school, his name was Joseph Pizzorno, he sat down and he talked to us, and he told us that we're there for a reason, and we're there to figure out what's going on with patients, to really talk to them, to connect with them, to find out the root causes of illness. And I never forgot that. It was very powerful, one of the first days of school, to start with that philosophy. And I've been in practice for about 11 years, and with each patient I see, when I sit down with them, I want to know and I want to think about, well, what is it that's going on with this person that's causing these issues, and what are causing those issues that are causing those issues?
You gave me an awesome example with regard to that in psychiatry or in mental health, and I think that was a really powerful one that you shared. Can you share that earlier?
Sure, and I think Dr. Brogan probably agree as well. You know, I've written a few books on anxiety and on depression now, and one thing that I've learned is, first of all, most of the patients I see come in and they're already on antidepressants. And antidepressants are a tough road because, you know, research shows that at best they work maybe 25 to 30% of the time, at best, which isn't really any greater than placebo, which kind of tells us that, you know, they're not really doing their job. And even for people who seem to get some benefit within a short amount of time, within a year to 2 years, they stop working anyway. And one of the issues that I definitely see with that path is that when people get off medications, even if they worked, but they have to stop taking them for some sort of side effect, or they stop working at that point, they go through all the issues and all the emotions that they had that brought them to that prescription to begin with. So it is a bit of a dead end, because if you're not looking at the underlying root causes, if you're not looking at why a person's not sleeping, what they're eating, whether they're exercising, whether they're stressed out and why they're stressed out, and looking at their poop. Poop is so important. If you don't get their digestion right, there's no way you're going to get their neurotransmitters right. And I think that's one of the mistakes. You look at antidepressants, and the problem is that you're going after neurotransmitters, and that at best is a symptom of other underlying issues, because why are they out of balance to begin with? It's not a person's chemistry. There's a lot more going on.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you called Harnessing the Power of Community in Your Practice, and it'll give you a clinical model, practical tools that double as marketing, and strategies to develop a community of your peers. All you have to do is click on the link below.